Welcome to Medical Myths, Legends, and Fairytales. I'm your host, Dr. Alan Christianson. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C here with you. Welcome back to the Thyroid Beginner Series. This one's about supplements, and this is important. They have their place, they can help, they can also get in the way. You know, this is a crazy stat, but of those who go to an emergency room and have signs of acute liver damage, 20% of the time, it's caused by people overusing supplements. Not certain supplements that are bad, but just too high of a supplement count. So yeah, they can be helpful, but too many can become counterproductive. So first off, you want to make sure you're not taking things that harm your thyroid or set things back. And that's going to be those that contain iodine. And in most cases, that'll be labeled, that'll be transparent. There's a lot of different names for iodine, and some companies will say that this kind is different or that kind is different, or atomic iodine or nascent iodine. There's a lot of different names, but iodine's an element. And what that means is that it works just because of its iodine. You know, there's nothing you can really attach to it that will make it act differently in the body. So yeah, iodine is iodine. Now, there's a couple of supplements to be wary of that may have it, but may not list it. And generally, these are called thyroid support products. It's kind of scary, but there are some supplements that are cow thyroid tissue. They're called thyroid glandulars, and they're called bovine thyroid glandulars. And they actually have synthetic thyroid hormone added to them in a really high percent of cases. This has been shown by these products being bought and then analyzed. But a lot of thyroid support products, they can have bovine glandulars and they can have iodine in them, even if those things aren't on the label. So those are things to really be cautious of, even if they have ingredients that shouldn't be that you wouldn't think would be problematic. If they say thyroid support, that's actually a red flag for your thyroid. Sad thing, but that's true. So yeah, avoid iodine, avoid thyroid support products. It's also good to be cautious of those that contain synthetic B6. Now, this is called pyridoxine HCl, and it's a kind of B6, but those prone to thyroid disease can't always process it well, and it can actually cause a lot of symptoms for them, such as nerve pain or anxiety or tremors, movement disorders. But that's an important one to avoid as well. And in general, those that have high amounts of manganese can be an issue. Somewhere above 5 milligrams of manganese per day can slow the thyroid. So those are the biggest things to look out for. So what do you want to include? Well, you want to get just some basic micronutrients. There's so many little things that are helpful, and they're not needed in high amounts, but they should be present in reasonable amounts. These are pretty much all your vitamins and minerals. So zinc, copper, selenium, magnesium is appropriate. The body needs the B vitamins, vitamin C, vitamin D. When I wrote the Thyroid Reset Diet book, I was following clinical trials on dietary changes that benefited thyroid disease. And I also saw clinical trials on then different foods. And then that led me to clinical trials on different nutrients. And there's a lot of studies saying that any nutrient you can think of is important to your thyroid. And there's also several studies saying that some nutrients can help to heal thyroid symptoms and thyroid problems. And that inspired me to make the thyroid-specific formulations line. I was really just flabbergasted to see how much good data there was and how it wasn't being used by any of the current thyroid supplements. Like really none of them had the things that were shown to be helpful. So yeah, I made a new line for that purpose. And in making that line, I wanted to make sure no one was going to get too much, that there wouldn't be redundant ingredients. Some people might be taking several products, and I wanted to make sure they wouldn't end up getting too much of any one thing. So when I made it to where the Thyroid Daily is meant to go for anyone. So anyone with thyroid disease or that just wants to prevent it, Thyroid Daily is a good foundational micronutrient. And it's just one pill once a day. You take it in the morning with food, and you've got B vitamins, you've got the minerals, you've got vitamin D in there, you've got all these important things. And every single nutrient there's a story to tell about which type is best for thyroid disease, how much is best for thyroid disease. And yet every line item in that is specific. It's specifically formulated to be good for those with thyroid disease. So that's the foundation for everything. Now, there's a lot of data arguing for benefits for a little more magnesium, for calcium, for essential fats. So then I also made Omega Pure, which is a iodine-free fish oil. That's tricky. Fish products, ocean products often have a lot of iodine, yet essential fats are important. So Omega Pure fills in that gap. So the triad of the Thyroid Daily, Omega Pure, and calcium magnesium, that's called the Daily Reset Bundle. And that's really a good foundation for anyone with thyroid disease to start from. So whether it's hypo, Hashis, whatever else, that's the starting place, even hyper. Now from there, the thoughts are, what are the other concerns? What are the other goals? So the first thing to think through would be autoimmunity. If someone knows they have positive thyroid antibodies, or if they're told from their ultrasound that they do, then you want to control that. And that's a big way of managing symptoms and improving your health and cutting the risk for other thyroid problems. There have been clinical trials on Nigella seed extracts, inositol, and selenium for lowering thyroid antibodies. And they're very safe and very consistently effective. So I made those into a blend called Antibody Support. And anyone with Hashimoto's, that's appropriate for them to include. Then we think about hypothyroidism. Yeah, when there's a lack of thyroid hormone. This slows metabolism, it causes fatigue, the body's thyroid is not making enough. And there's good data that things help with that. Things like valine benefits your body composition. Things like methylsulfonylmethane that helps your body free up lost thyroid hormones. Things like vitamin A can help your body respond better to TSH. So hypothyroid support is to help the problems associated with hypothyroidism. Now, this is not a replacement for medication, but when someone is working to help their medication work better or take as little medication as possible, hypothyroid support can improve their symptoms and help their thyroid have the best chance of working better. And as I go through these products, just know that they're all compatible. So if it sounds like you need more than one, that's actually okay. They're all meant to be safely combined when appropriate. Then we think about those who have thyroid nodules. I'll talk more about those in a separate podcast, but they're important. With adults, as many as half of adults have them, and they're risk factors for thyroid cancer. And there have been clinical trials showing that nutraceuticals can help to shrink nodules and cut their odds of becoming cancerous. So thus was born nodule control. Then there are those who have hyperthyroidism. Either they were over-medicated for quite a while or they have Graves' disease. And there's good data saying that, CoQ10 can protect the heart and extra vitamin C can cut the risk of thyroid eye disease. So I made a blend called Hyperthyroid Support for that purpose. Then we think about those trying to manage body weight and those struggling to lose weight with thyroid disease. There's lots of evidence that white kidney bean extract can help maintain muscle mass during weight loss and help to lower insulin. There's good data that cayenne extracts can boost metabolism for those with thyroid disease. So these are some of the things that went into metabolism boost. But those are the top few goals. So with thyroid disease, the foundation is really key micronutrients, the right ones, not too much, specifically made to improve your thyroid. And the Daily Reset Bundle is a starting place for that. Easiest thing to do is that on the thyroid-specific formulation shop, there's a quiz, help me choose. And you can just go to that and put in your diagnosis, your key symptoms, your key goals, and it will recommend a short, reasonable list of nutraceuticals to help. And some are great for long-term, like the Thyroid Daily Bundle. Others are totally appropriate while you're fixing a problem, like shrinking a nodule or lowering an antibody or reversing hypothyroidism. But overall, you want your pill count to be very specific to thyroid needs. You want it to be targeted, and you want it to not be excessive. The thing I would encourage you to avoid is to, there's always a new pill with lots of promises, and people often end up with this overloaded medicine chest of all kinds of stuff, and in many cases aren't even sure what a lot of it is for. So yeah, keep your pill counts as low as possible. The more things you take, the weaker everything you take becomes. It's just like making soup. The more flavors you add in, the less you can taste any one flavor. So yeah, keep it targeted, keep it specific, and keep it simple. And know that when done well, these things are safe. They can be food extracts. They can be naturally occurring compounds in plants, and they make a big difference on your road to healthy thyroid recovery. All right, Dr. C with you. In this next one, we'll talk about more in depth on nodules, how they matter and how to screen for them. Take great care, and we'll talk soon. Hey, Dr. Christianson here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christianson on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.